You're watching this DVD for one of three reasons. You either have sickle cell disease, sickle cell trait, or you need to get tested to find out if you have them. Operation Sickle Cell of Fayetteville, North Carolina has a mission to help you understand what sickle cell disease is, to make sure you get tested, and to provide you with information, free counseling, and free referral services. Please call 910-488-6118 today for more information. There are a number of myths about sickle cell disease. For instance, that you can catch it. You can't. Some people believe that sickle cell disease is the African American disease. That's not true. Anyone of any nationality or any ethnic origin can have it.
The male is the one who carries the sickle gene. No, anybody, male, female, can carry it.
It's not a blood-borne illness. It's a genetic disorder, and it doesn't skip generations.
It only comes in the fourth generation or something like that. No, you can't say that. It can come at any time once those abnormal genes mix.
Those are just a few myths about sickle cell disease, a very misunderstood condition. Here are a few more. An elementary school teacher thinks she's got a bad student on her hands. Her second grader sleeps through class and spends most days with her head on her desk. A platoon commander labels a soldier a slacker because he often says he can't participate in PT and spends so much time in the infirmary with joint pain. The second grader and the soldier represent an entire population of people, young and old, who suffer from sickle cell disease, a genetic disorder that affects the blood, creating rigid, brittle blood cells that don't easily slip through the blood vessels like normal blood cells do, causing pain.
Crisis episodes where they have pains that may be in the joints, their legs, their arms, their back. They have to be hospitalized sometimes, IV fluids, blood transfusions. They may be in for a day, they may be in for a week. You don't know, and it can be very painful.
Sickle cell disease patients can learn to cope with the pain attacks and get control of their lives. Operation Sickle Cell is ready to help.
We feel it's one of our objectives to provide as much knowledge as possible and let the individuals know that they do have options.
We have an open door policy. We provide free education, free testing, free counseling, free referral services.
Operation Sickle Cell offers all of these free services to people in Cumberland, Robeson, Harnett, and Hoke counties, and make sure lack of money does not get in the way of their clients' quality of life.
A lot of my clients didn't have insurance. Through North Carolina Purchase of Medical Care Services program, there is an actual medical coverage that's provided to sickle cell clients dependent upon their household size and their annual income after taxes. They'll pay for stay in the hospital, 7-day stay in the hospital annually. They'll pay for a trip to the emergency room once a month for a year, medications and supplies for the treatment of sickle cell disease. It'll pay for your primary care doctor. It'll also pay for specialty care.
North Carolina tests every newborn baby in the state for genetic blood diseases, including sickle cell disease. Those newborns with sickle cell disease are referred to community-based case managers for follow-up. Operation Sickle Cell has been here for nearly 40 years, offering support to babies, children, teens, and adults of the sickle cell community. Operation Sickle Cell is there for moms who discover after delivery that their children have sickle cell disease and is ready to support them from day one.
We have case managers who immediately contact these mothers with these babies and make sure that they get into a quality care system for those children.
There you go. I get down on the floor and I play with them, and while I'm playing with them, see, I'm doing developmental evaluations.
Ruby McNair makes sure that children who have sickle cell disease are at their correct developmental level. She also tries to find out what their family needs are so she can plug them into whatever available community resources they can get to make their quality of life better. Making the quality of life better for children and adults and their families. That's the mission of Operation Sickle Cell. The needs of adults are different, however, than those of children who suffer from this disease. Operation Sickle Cell is ready to answer that call as well.
When you're born with sickle cell disease in any of my 4 counties, any pediatrician will take care of you. By the time you hit 18, it's a hands-off.
A good number of doctors shy away from adult sickle cell patients because of the number of pain medication prescriptions necessary to manage the disease on a yearly basis. Doctors don't see sickle cell patient care as cost-effective, and they don't want to have to manage that care. But Operation Sickle Cell has the answer for that as well. We help adults find doctors who will take care of them.
We've partnered with Duke Medical Clinic, or Duke Comprehensive Sickle Cell Clinic, for the coordination of specialty care. And finally, education to the sickle cell trait population.
Other partners include Stedman Wade Health Center and Southeast Regional Medical Center. They offer primary medical services and also work with our Duke partners. There is a distinct difference between sickle cell disease and sickle cell trait. A person can have sickle cell trait without knowing it because most people with sickle cell trait exhibit no symptoms. But there are very important things to know about sickle cell trait and what can happen. People with sickle cell trait don't have the many physical problems that people with sickle cell disease suffer from, but they can pass the sickle cell gene on to their children. People with sickle cell trait also have to know if the person they're having a baby with has sickle cell trait.
If 2 people get together and they have sickle cell trait with each pregnancy, there's a 1 in 4 chance the baby will have sickle cell disease.
But you don't know which number is going to come up which time. And see, that's a lot of what people think, that I've got 1 in 4, so I can have 3 children and don't have that 4th one and I'll be okay.
This thinking is wrong. A 1 in 4 chance of sickle cell disease with every pregnancy means that every time 2 people with sickle cell trait have a baby, there's a 25% chance that the baby will have sickle cell disease. That's like putting on a blindfold and sticking your hand into a bowl with 3 green beads and 1 red bead. You can hope to get a green bead every time, but you might get a red one every time. There are no guarantees. Operation Sickle Cell wants people to know what their options are.
We try to find as many trait persons as we can because they need to be informed about with respect to family planning.
Both men and women need to know their sickle cell status.
They need to be informed, know what their status is. They can make those informed decisions. Maybe we won't have as many children being born with the disease.
The people of Operation Sickle Cell are committed to getting the word out about sickle cell trait and how to deal with sickle cell disease. That's been the mission for over 30 years and will be the mission for years to come.
The mission is, has been, and always will be to enable these persons with sickle cell anemia to live lives that are uncompromised, unhampered by having sickle cell anemia. That's just the mission, and that's what we will continue to do.
Call Operation Sickle Cell at 910-488-6118. We offer free testing, free education, free counseling, and referral services. If you have sickle cell disease, free case management services are also available. Operation Sickle Cell is located at 2409 Murchison Road, Fayetteville, North Carolina. Please call or come by today.